So our next keynote address is from Karen Beard-Greer. Karen is a board member of the New Zealand Federation of Disability Information Centres Executive, past chair, and founding member of Create Asia Alliance, established in 2014, which you will hear about today. Karen is also the CEO of the Independent Living Service Charitable Trust, a director of Manawanui in Charge, past chair again, and is a member of the Institute of Directors. Karen has been working in the New Zealand disability sector for 7 years and has well-rounded range of governance and senior management skills from both the private and not-for-profit sector. Karen has a passion for innovation and questioning the status quo. The World Health Organization estimates 1 billion people need one or more assistive products. The majority of these are older people and people with disabilities. Create Asia was formed in 2014 by 13 countries throughout Asia Pacific, including New Zealand. Karen was part of this founding coalition, seeing an opportunity to align New Zealand with these global initiatives. Today, Karen will explain how Create Asia is working with the World Health Organization to deliver on their key priority of making assistive technology more accessible to people with disabilities in the Asia Pacific region. Please put your hands together and warmly welcome Karen.
Kia ora tātou. I'm just going to put on my assistive technology. The aim of today is to let you know about some of the initiatives that we're working on in New Zealand with more of a global reference, and not many of you in the room will know about the Federation of Disability Information Centres. So we are operating specifically in the disability sector, and it's a peak body for member organisations that hold DIAS contracts, Disability Information Advisory contracts. So the Federation works with its members to really raise the bar, to provide professional education and to sort of lead and connect member centres and organisations around the country and guide them to perhaps what's coming up with innovation and trends. And I just want to say we hear a lot about the budgets that we get and the funding that we get, and there's never enough money, but I want to acknowledge everyone in the room today and what Lance is doing. In New Zealand, people are innovating and challenging the status quo and being disruptive regardless of what funding they get and regardless of what's happening in their sectors. So there's a lot of amazing things happening, and it doesn't always come back to the funding. I look at what a lot of our Federation members do and how they've worked on their local, regional and national level. And what they're doing is amazing, amazing stuff at the community coalface. They are connecting and directing with their people, and they are making a significant difference at a local level that none of us really understand just how much work's involved. And I know that all of you are involved in those organisations. So I'm going to take you off on a tangent, and you're going to think, what on earth is she talking about here, and what's the relevance? And then I'm going to bring you back to how it relates to us in New Zealand. So bear with me. There's a little bit of jargon, and I'm going to try to make it plain language for you. And if I talk about me and where I came from in terms of how does this relate, I was brought up in a low socio-economic family in North Canterbury. I remember the day that I saw my mother fighting with my father because he'd drunk away the last of the family benefit and she didn't have enough money to feed us. So we appear in all shapes and sizes, and it happens everywhere in New Zealand. And then if I look at how technology has impacted my life, I'm a sort of a 70s kid at school, and the latest technology for me was learning to type in high school. And then I decided I've got to do something about this. I don't want to be a part of that type of upbringing. So I decided that I was going to be an air traffic controller. And I remember the day my father said to me, "You can't do that." And then he was the proudest man on earth when I did do that. But also, in terms of the technological change, and every one of us in the room has experienced it, I was brought up, like many of you, with the party line, the telephone, and then I became an air traffic controller, and we did it all manually. So we used to control aircraft by using maths and physics and angular displacement. So what that meant was when two aeroplanes were head on and you had to get them at different levels, you calculated the estimated time of passing, and then you worked out 10 minutes prior to each one, and then you had them on different levels. Now, I did that in Rotorua manually, and we used to have little strips of paper. And then 10 years later, so this is where technology clicks in, 10 years later, I was sitting at a radar screen in Mangere at Auckland International Airport, controlling that same area, but with technology. And so the start of that happened, we were using World War II radar, and we used to sit in a dark room with the curtains closed. And then less than 2 years later, technology expanded and we were on secondary surveillance radar, daylight radar, sitting in a room like this controlling aeroplanes. And fast forward now to where we are with our mobile phones and what Lance has just shown us, and it's absolutely incredible. So that's why I like technology and innovation. Let me talk about Create Asia. What is it and how does it fit in? So what it stands for, it's an acronym. Create Asia, the Coalition on Rehabilitative Engineering and Assistive Technology. It's quite a mouthful. But literally what it is a group of organisations, an alliance of organisations throughout Asia and the Pacific who are interested in developing and working together, creating more communication and more collaboration around this term assistive technology and the provision in the systems. But for some of you, assistive technology is probably a new term. For the health industry, it's not. Many allied health professionals use assistive technology. In the disability sector, we talk about equipment, equipment that our clients need. So let me talk about the difference between the two. Assistive technology. My glasses are an assistive product. Assistive technology is the term we use for the systems and the skills and the services that provide that whole care. So as a disability information centre, when one of my workers, one of my information specialists works with another disabled person and they're advising them, they might be talking to them about an assistive product, being the glasses or a wheelchair or a prosthetic. But it's the care and attention and the services and the skills around that that makes it assistive technology. So as I go through, I just wanted to clarify that because I don't want to be talking at you. I want you to be understanding what I'm saying. So iCreate, where does it start and what does it mean to you? iCreate is the International Convention on Rehabilitation Engineering and Assistive Technology, and it started back in 2007 as that, an international convention. And it were the countries of Singapore and Thailand that got together and said, there's an awful lot of information around, there's an awful lot of universities and professors and robotic engineers and manufacturers and suppliers and allied health professionals and people like us and consumers, and we need to have a bigger conversation. And Professor Wei Tak Ang, who's still at the head of this organisation in Singapore, had a vision, and the vision was quite remarkable. So at that first conference, what they did was they got like-minded organisations throughout Asia Pacific and a lot of very academic people together, and they started having a conversation. 5 years later, very loosely, an alliance was formed in 2013 at their conference. I got invited to the first official meeting of iCreate, or Create Asia, the alliance, in Singapore in 2014. Now, I have to admit, a lot of it when I got there was incredibly academic. You've got robotics engineers and a range of people. I thought, what on earth am I doing here? What's the relevance? But I could see immediately that there was a place for us in New Zealand, and I just knew I needed to hang around these people a little bit longer so that I could bring this information home and do something with it in New Zealand so that our people didn't lose out. So what happened was that further meetings were held and an MOA was signed with the Princess of Thailand in 2015. What does that mean? The Princess of Thailand is very supportive of the global view of disability, and especially in her country, and she is the patron of this conference that happens every year. So, not knowing where I was going, I decided that the Independent Living Service, my day job, we would sign as the New Zealand signatory for Create Asia, just so that we didn't lose it to another country or to an organisation that didn't appreciate what we might need in the disability sector. And I knew that ultimately it probably wasn't going to sit with us because we were an individual organisation, that it probably had to move beyond us. And I had in my mind the Federation of Disability Information Centres, and the reason I had that in mind was because all of our organisations work with what we call in New Zealand disability equipment, assistive technology. So last year at Kobe in Japan, we assigned over the membership from the Independent Living Service to the New Zealand Federation, and I'll get to where this is significant just shortly. But the countries that are part of that alliance, you can see there, Singapore, Thailand, Malaysia, China, Taiwan, Hong Kong, South Korea, Japan, Australia and New Zealand. And there's even talk of places like Libya joining, so it's really quite interesting. But here's the important thing. Create Asia has really 3 important goals, and the important goals are aligning with the World Health Organization and helping them to achieve their goals. It is to develop up the Asia Pacific Assistive Technology Portal, which I'll explain what that means in a moment, and it's to continue to run the conference that I've spoken about. So my introduction told you about the World Health Organization. More than 1 billion people, mostly elderly and disabled, are in need of one or more assistive products. And you can see there with the populations ageing and the more and more that people are presenting with a range of disabilities, that's set to double by 2050. And only 1 in 10 of the people in need actually get access to the types of assistive technology that they need. And you can see that the low to middle income countries, of the people that need things such as hearing technology, only 3% of those in need get access. And we know that that's a huge problem here in New Zealand as well, even for what's considered globally, quite a wealthy country. So the World Health Organisation's goal around assistive technology is quite simply improving access to assistive technology for everyone, everywhere. And what I want to do is just turn the pages here to make sure I don't miss out some of the notes I've made. When you think about what our governments are trying to achieve and the disconnect we've got within, what's available in budgets, and it's no different in New Zealand, as we know. When you're talking assistive technology, we've got to look at affordable and appropriate access, and that requires government commitment to ensure we've got adequate and sustained funding and procurement, and that's a real issue for us all. In many high-income countries, people are able to access assistive products via health or welfare systems. But often, and here's where it matters to us, where services exist, they're often standalone and fragmented. People must often attend multiple appointments at different locations, which are costly and add to the burden on users and caregivers, as well as the health and welfare budgets. Does that sound familiar to you? And I look at the inequities with the staff that I employ, and I employ a range of people with disabilities, and I've got 2 staff members, both who use wheelchairs. One who comes through the Ministry of Health system and one who comes through the ACC system. And you know what I'm going to say. My staff member who comes through the Ministry of Health system, and it's no disrespect, it's just the way things are, I look at when he needs his chair adjusted and he needs care and attention and services, we have to grind every step of the way, and I write 1 million letters for a whole range of funding versus my worker who comes through the ACC system who's got the latest, greatest wheelchair with the fanciest wheels and carbon fibre, and it's just inequitable. So what are we doing about it? Assistive technology, and this is the thing I want to talk about, and somebody please give me a countdown if I run over. It's been reprioritised by the World Health Organization as an essential medicine. What does that mean? Well, it's really quite significant, and that by reprioritising the list of assistive technology, it now means that it becomes a basic human right, not just a nice to have. So think about the people that you deal with every day that need equipment, assistive technology in some form. By reprioritising an essential human right. So in 2013, at the UN Convention on the Rights of People with Disabilities, there was a key group of stakeholders that challenged the WHO, and what they did was they said to the WHO, we want you to respond to this inequity with assistive technology. So the WHO went away after that meeting in New York, and they had to work out what they were going to do by the challenge set to them by the stakeholders. In 2014 in Geneva, and I think some of you in the room were at that Geneva conference, the WHO responded, and they responded to the stakeholders with what we call the GATE initiative. Now, some of you will know what that is and some of you won't. So the GATE initiative is the global cooperation on assistive technology, and it's only got one goal. And the goal is a world where everyone in need has access to high-quality, affordable, assistive products to lead a healthy, productive, and dignified life. It's pretty simple. So how are they going to do that? Let's look at who needs assistive technology. And if we put it in the context of New Zealand, who do we know in New Zealand that needs assistive technology? Yeah, we all do. The people that most need it in my sector that I'm dealing with are older people and people with disability. And that's purely because that's the demographic of the area that I serve predominantly for the people I'm looking after. But we've talked about some of the issues with mental health and funding and some of the reviews that are happening. We've spoken about that this morning. So people with mental health conditions, including dementia and autism, people with gradual functional decline, and people with non-communicable diseases. The products that are essential tools, what do? They compensate for an impairment or a loss of intrinsic capacity. They reduce the consequences of gradual functional decline. They help minimise the need of caregivers, prevent primary and secondary health conditions in some areas, and they lower health and welfare costs. So it makes sense to think about this stuff. They're often the first step towards a lot of the social inequities that we see across all the organisations that we work for and with in health and disability. So getting out of bed and getting out of one's house in the morning. And I know that that's an issue, with my guys with disabilities. If a care worker doesn't show up in the morning, what happens to that person? What happens if they don't get access to the chair they might need to get into the disability taxi that they need to get to my office every day? Accessing education, work and employment. Escaping from poverty and hunger. Greater mobility, freedom and independence. And what is it that most people with a disability or that are ageing in place tell us that they want? Same as everyone else. Independence, a good life, as good a health as possible, the right to a job, the right to a relationship. Inclusion and participation, and leading a dignified life. So what does that mean? Priority assistive products list was something that the World Health Organization developed. So what it's aiming at is guiding a whole range of nations across the world, all the people that buy into the UN Convention on the Rights of People with Disabilities, on the most prioritised list or categories of assistive products. So what they did was they started with 150 assistive products or categories, and they honed it down with input globally from stakeholders, people with disabilities, older people, universities, everybody. And they've come up with this APL, a priority of assistive products list. And the next steps for this list. The WHO's not done this in isolation, they've developed it with tools, and this is where the Federation comes in. The Federation is leading the charge with Create Asia for this in New Zealand. So the WHO's designed the tools, and they call them the 4 Ps. The first P is the APL, the list of assistive products. And then they're looking at the policy and the framework that goes behind that. There's a lot of policy and framework in New Zealand, so we're going to look at how we can guide the policy and framework utilising Create Asia and the World Health Organization goals. So that's what the Federation's doing. And then the WHO focuses on personnel. We need good training systems and programs. In our sector, where the Federation works with its members, we do a lot of training on assistive technology, and we try to provide the framework that we actually upskill our workers and upskill so that we get better outcomes for the people that we're serving. I'm going to talk about some more of the initiatives in just a moment. And then there's the whole delivery model, and that's where we all work together as organisations. Now here's a little bit of jargon, and I apologise. So what's some of the work this group of Create Asia countries, including New Zealand, is working on? Eastern, an acronym. The European Assistive Technology Information Network is working directly with the WHO. They are absolutely aligned, and what we're doing as Create Asia is working directly with Eastern. Now, Eastern is a group of European countries, and they have 7 databases for assistive technology. So what that means is if I'm in Italy and I go on looking for a wheelchair, I can search the Eastern portal for assistive technology, and it will bring up a whole selection of wheelchairs and assistive technology that may suit my needs as a person needing to use a wheelchair, and it gives me a range to choose from. The AT portal for Asia is being developed, and there are 4 countries on there at the moment, and New Zealand will be on there very shortly. And the organisation that's going to be on there with the New Zealand database is Enable New Zealand. They have an AT database, and what they're doing is they are just coding it with all the right ISO codes, and then it will get uplifted. So the aim of this organisation, Eastern, and Create Asia, is to join up global databases to deliver on the WHO goals. And that's really, really exciting, because that means that disabled people, elderly people, anybody needing assistive technology the world over can get access. So I put down there, Eastern only allows 1 agency per country who's a principal contact, and that person must be working with government. So Enable New Zealand is our principal contact in New Zealand. So what is the Federation going to do about all this, and what does it mean? So Enable New Zealand has, just like Access Able, many of you know in New Zealand, they have assistive products available for a range of health and disabilities. And what Enable New Zealand is doing is it's working to link up the Asia, or the New Zealand part of the Asia portal. The Federation is going to drive a campaign to use the globally accepted term of assistive technology in New Zealand. So most of us talk about, when we have our equipment or our contracting through Ministry of Health, where we get our contracts from, we talk about equipment contracts. New Zealand's the only country in the world that doesn't use the global term assistive technology. So that's going to be a key area of ours. And we're going to look at the adoption of the policy framework. The training packages. The Federation has joined forces with Assistive Technology Australia, and we're bringing into New Zealand the AT Mentor program that was developed as part of the NDIS, which puts disabled people at the centre. So what it is people like, I've just said to you that 2 of my workers live with disability, and they also work with assistive technology, and they guide and connect and they direct people and they advise them on equipment. That's what an AT Mentor is. But that role is designed for people with disabilities. So we're bringing that program into New Zealand. It's 17 competencies. In Australia, it takes 10 months to complete that, and it's a fairly sophisticated certification that people with disabilities can use to get out there in the workforce and give themselves a good life. The provision of assistive products is just about continuous improvement. We work with assistive technology in a range of our centres and our member organisations, and those of you in the disability sector, as opposed to just health, will know that you can access equipment from a variety of areas, and we just want to look at continuous improvement along the whole supply chain and the provision of AT throughout New Zealand. So, I remain an international organising committee member, even though I've stepped down as the ILS CEO of Create Asia, and I represent the Federation along with Scott Ambridge from Enable. And we're working with Create Asia to bring these World Health Organisation goals and our little part of the disability sector into New Zealand to actually be part of the bigger global movement and address some of the inequities that we see happening not just globally but here in our New Zealand communities. And we look around New Zealand at what we see with local communities, and we work with councils around access. AT and the focus on AT can make a tremendous amount of difference with no more funding than it's already got. Organisations, as I said before, have already innovated and created new systems to respond to the needs of our people in New Zealand. It's happening, whether we're funded for it or not. There was a report done for the Dyer's NASC review that a lot of people will know came out about 12, 18 months ago, and what it said about the organisations that I belong to is that we're there and what we do is we just get things done. The funding that we get equates to about 10% of what we actually do, and the rest of it is just there to get things done. And I watch my team at the organisation that I work in work with people that are non-verbal and they don't get the access to the services that they need. And we just get in and we get things done and we advocate and we do all the things that we need to do to ensure that person has a good life. So the exciting thing is the Federation is co-hosting the 13th I Create conference in Canberra in August 2019, and we'd love you guys to be a part of it. So this is a big part of what I Create does. It brings the researchers, the academics, the manufacturers, the suppliers, the organisations like ours and the consumers all together at once. At these conferences, there is always a global student innovation challenge. And this is fantastic because it happens not on a really sophisticated level all the time. So what it does is it encourages students from around the world that might be doing robotic engineering or some type of science subject or some type of engineering project, and they get to design assistive technology for people with disabilities and older people. And some of the innovations are amazing. They're not always sophisticated. So I was speaking to Professor Andrew McDade 2 days ago, and I don't know whether any of you know him. He's a professor of engineering at Auckland University. When I met him in 2014 in Singapore, he had a research team of 3. And he said to me on the phone that he had now a research team of 20, and they lead the world in some of the world's robotic engineering, and especially for cerebral palsy and stroke globally. Did we know that? Here in New Zealand. So Andrew McDade is going to be speaking in Canberra. He's also going to make sure that Auckland University and Canterbury University enter a team of students into the Student Innovation Challenge. So if that interests anyone, then have a chat to us afterwards. So there we are. It's a trans-Tasman collaboration. We'd love to see as many of you there, policymakers, Ministry of Health, government officials, universities, anyone that is interested in technology and where it's going. If you've got any more information that you need, you can contact any of us in the Federation exec, or you can contact myself specifically, or Scott Aimbridge, who works directly with Create Asia. So I hope that's been informative, and I'm here if you've got any questions. Thank you.
Have people got questions for Karen? Or are you all just blown away? Because I can tell you right now, every single one of you are going to, if you're not using assistive technology right now, or the products, you're going to be using them, and at least 5 to 10. So you should be very interested in this, because I am. Karen and I have been talking over years about my hover shoes.
Yeah.
Yes, and she has said to me that I should put weights in them. So I've moved on now to having a bit of weight to hold me up, to a gyroscope so I don't fall over when I'm 93. But this is an incredibly important thing that we've all heard here today. You will need it. Otherwise, there's going to be a rest home with your name on it already being planned. So use assistive technology, and I want to encourage people, like Karen has said, to actually maybe put your name down for something like this and go to Canberra in 19 so that you can actually be part and parcel of New Zealand punching its weight far above the world, basically. New Zealand always does this, and Karen has demonstrated that by being part and parcel of I Create and Create Asia, and actually putting our name on it. You know, that was fantastic. So, congratulations, and thank you on my behalf and all of these people here.
Great,
Lovely.
thanks.
Thank you.
Thank you.
Thank you.